Okay, hi Danny, it's Dr. Buford. We're just getting started on your right shoulder. We're looking at from the back to the front. Everything's magnified a bunch, like 30 or 40 times on the screen. We've got a shaver coming in just to smooth out some of these rough areas. You can also see some of this old suture material. Pull back, Mitzi. Thanks. And your biceps tendon's already been released, it looks like. And usually that suture's in the edge of the tendon, which means the tendon would be way down here. So that's the edge of the rotator cuff way down here. Now, some additional suture material here. We'll pull that out. So bottom line is we've got a really large tear in the rotator cuff tendon we're going to have to try and revise here. Pull back and see. Okay. Okay, we'll look down the front of the shoulder here. Push in. And as we look in the front here, we don't really see much else to do. Push in, we'll look at the subscapularis tendon. I think that's going to be okay. We'll look towards the back of the shoulder here. Okay, we're going to put the camera in the front and have a look from the front to the back. Pause, please. Camera, please. Okay, so now we're looking from the front to the back. There really isn't much else to do inside the joint. You can see the labrum's looking kind of degenerative, and the cartilage is a little bit frayed here on the socket. You can see how the labrum's a bit frayed too. We've been smoothing this out a bit. There's really nothing else to do. It's not unstable where it needs to be repaired or where that would be of any benefit, I think. As we look towards the back, we can see the posterior part of the cuff looks to be intact to here, but then there it stops right there. And just kind of, we run out of tissue down here. See, that's rotator cuffs. We'll go off on the video. We're going to have a look from the other side. Pause, please. Okay, so what we're doing is we're actually revising this decompression because there's still a little bit of bone hanging down here that I think we don't want to potentially pinch on the rotator cuff when we're done here. And so we've got this burr, and we've just taken off the anterior lip of the acromion here. So you can see how that now looks a lot flatter. A lot happier with the way that looks. So your clavicle's over here. We're going to work on that also. We'll go off on the video, show you some more in a minute. Pause, please. Hold the camera. Okay, here's the AC joint. We've taken off a fair amount of bone. We can get more than the width of our burr in between the acromion and the AC, and the clavicle rather. So that's going to be a good resection. We're now going to look down at the rotator cuff tendon and decide what to do with this large tear that you see there. I'll put the shaver in the front and show you this tear here. So this is the posterior extent of it here. We'll look back over the posterior aspect of it, make sure there's no more scar tissue back here. Okay. And then we'll look up here. Looks like there's still a bit of suture material right here. that's basically the posterior edge of the tendon. This is the anterior edge of what's. And we're going to start by placing what we call side-to-side sutures across the tear, starting from the back. So we'll start with this suture hook coming in from the left side of the screen. Here it is here. And then we'll take this crochet hook and we'll come into the edge of the tendon. Stay right there. Come back. We'll come through there. And then sometimes we can do it in one bite. But if not, then we'll take two. Okay. Stay there on the screen. I'm going to use this stuff. And now outside your shoulder, we're going to load that with a stitch. And then we'll pull back. So once you pull back, you can see how that is going to create this loop of suture. And that's what we're going to tie next. We're going to tie this right here. Okay, pause please. Okay, so now we're going to tie this knot. You can see as we pull how it's going to snug that up. There's our tear. We're going to do the same thing one more time, at least, because it looks like that's what this tendon needs in order to have this hole sealed up. Okay, so next we'll cut the suture tails. And that's the first stitch. Now, we've got a couple decisions to make. We probably want to place a suture anchor in next, just to make sure we don't close down the gap here. So we'll go ahead and get that done. Pause, please. Okay, let me take that. Okay, so we've done our side-to-side stitch. There's the first side-to-side. We went ahead and placed it full time. We went ahead and placed the suture anchor in. This is a triple-loaded suture anchor. We're going to go ahead and spread the sutures apart here. And it looks like we want to go with the blue and white suture first. Because it looks like we go blue and white, white, black and white. So we're going to reach in front. Take out this, hold this still. Take out this blue and white suture. We'll pull tight on the other ones. And so now we have that blue and white suture. Look down. See how we have it in front of the other one. So that looks good. So we'll go ahead and take a straight crescent suture hook. Once again, coming from the back here. And we'll look up underneath. And there's our pass-through with our relay. Okay, and I'll tell you what, we're going to go ahead and tie this one. Which means we want to reach in here and get the other blue and white suture. Looks like we may want to take it right here, huh? that down. That's going to really close down that gap. Okay? Pause, please. Okay, so now we've tied the first suture back here. You can see this is what we're looking at now. And now it looks a lot more manageable, doesn't it? So we're going to place another side-to-side suture. I think first we'll pass one of these other sutures from the anchor. So we'll look in here. And we know the white suture is the next one, correct? Let's look at that. Yep. And so now we have the next suture in line. This hook is going to be what we call a turn to the right hook. You can see it here. It looks like, look down. Looks like we'll be able to get this down to about there. Look over here. Okay, pause. Pause. Pull tight. Here we are pulling back. Come back so I can get this camera. Okay, now this suture we're not going to tie yet. We're going to do a side-to-side next, but we're going to go ahead and still get the partner suture. And look over here. Watch as I pull up. Yeah. Okay. Here's our second pass. Go to the left and right. Here's our second pass going across. And now load that with a stitch. Pause, please. Okay, we're going to tie another side-to-side suture here. There it is, coming down. Okay, so we're going to go ahead and clip the suture tails here. Okay, but you can see how that's really bringing that down together there. We haven't tied these white sutures yet on purpose because we haven't decided if we're going to do another side to side. It looks like we might. Pause, please. Okay, so we've placed two side-to-sides and that one anchor, and now we're going to place a third side-to-side going across right here. You can see where we're at. We're going to use these helping hands pincher tool here. There we are coming across. Pull back just a little bit at a time. A little bit more, pull straight back. Yeah. Okay. feed that through. Okay, pause. Give him that middle view a little bit. Okay, so here we are. We're going to tie that suture now. And again, this is the third side to side. Okay, so we'll go ahead and finish that knot. And now we'll cut the suture tails. And you can see we've got 3 side-to-sides. One, two, three. We've got 1 suture passed and tied. You've got to pass our next suture, which is the black and white suture. You've got to pass that next. So we'll pull that out the front. Go ahead. And then we'll take our straight crescent hook. No, look. We'll take our curve to the right hook and see if we can get a stitch in right here. Okay, hold the camera. So here's our other stitch right there. So this one, we just really want to seal this down here. If I can get this even over the top, I will. There we go, right there. I'm going to need a grasper, maybe. You got it? Grasper? Here you go. Okay, so now we've got it. We'll go ahead and get that pause. Okay, you recording? Okay, so now we've got both sutures passed. You can see where this black and white one went right there. Again, we still haven't tied anything yet. We're going to place a suture anchor in the front, although I don't think tying the white one would be a problem at this point. So maybe we'll go ahead and get some of these tied and get them out of the way. Pause, please. You agree? Okay, so we've got all 3 sutures now tied from the posterior anchor. Okay, that looks pretty good. I still want to place something here to anchor that anterior leaf. So we're going to place 1 more suture anchor down. And I'll show you how we plan that. We'll take this punch. And this is all anterior leaf. We'll take this punch and we're going to place this down. Pull back a little bit. Okay. We're going to place this down right about here. And now, although we'll have 3 more sutures to work with, we may not need all 3. We'll just see what the tendon needs to be stable. Look up here to the left, to the right. Yeah. So it looks like we're probably going to want to come in with a turn to the left suture hook, which means we're going to reach in from the back. Show me. Can you take it? Mm-hmm. Push this cannula in a bit. And then we're going to spread these sutures apart. Okay, so there we go. So we're going to start with the white one right here. Make sure we're not unloading. Very good. Okay, so we'll go off on the video for a minute. Pause, please. Okay, so here we are coming in from the front. We're going to reach down here. And there we are coming underneath. Pause. Let me take it. Okay, so we've got the white sutures out of the way. We haven't tied them yet. And now we're going to take, you can see we want the black and white suture next here. And I'm not sure what angle hook we need. We're going to check that out right now. Looks like if we bring that down, that'll basically cover it up, won't it? Look down to the right. To the right. Other right. Yeah, 5 o'clock. Just push the camera down that way. Yeah, so that's going to cover it all the way up right there. So let's come back straight. If you have one. If not, I can use that probably. Okay, here we are with our hook. We're now going to reduce the tear. Our hook down and all the way underneath like that. We'll feed it, and then we'll show you some more in a minute. Pause. Okay, so we've got this fully repaired. And again, like we talked about in the office, especially in a revision situation where it's a second go-round, this really just gets you to the starting gate. We have to hope there's enough healing and enough blood supply to get this tendon to heal. But we can see here as you rotate your shoulder that all moves together as a unit. We tied 2 of the 3 sutures anteriorly here, and you can see them both here. Okay? And so we've got that anchor down, and then we get way to the front. So that looks really good. That's a total of 3 side-to-sides and 2 suture anchors to repair this. So good luck to you now, okay? Bye-bye.